I can see on my MAR that I need to saline lock IV after second liter of 0.9% normal saline, and I know that my second liter is just about done. So first I am going to double check my patient, medication, dose, route, time, and documentation, the 6 rights of medication administration. So first I'm going to explain to the patient why we are discontinuing their fluid but maintaining their IV and keeping the IV in place. And I will start off discontinuing the IV by washing my hands and applying gloves. Oops. Again, whenever I see this patient, I'd like to note that she does have an allergy to penicillin and latex, and she has identified herself by her 2 identifiers. She told me her name and her date of birth. Okay, so I already have some gauze underneath the saline lock. So what I'm first going to do is stop the saline from flowing. I'm also going to grab my saline that I'm going to flush it with. So I'm going to start by keeping the gauze underneath and discontinuing the IV. There we go. Now that the IV is discontinued, I'm going to ready my syringe so that I can flush it with 5 milliliters of normal saline. Of course, checking the saline, making sure there's nothing wrong with it. I'm going to clean off my hub with an alcohol swab and take off the cap and prepare to flush my 5 milliliters of saline. Typically, it is ideal for the flush to have already, for the flush to show you the milliliters up, but that didn't happen, so we're just going to tilt our head. Okay, and that is 5 milliliters. I would have administered it slowly, so not to cause the taste of saline in her mouth or cause any complications. I also already assessed the site and made sure that there was no phlebitis, infiltration signs or symptoms, and that it was not warm, cold, and there were no signs of complications. I'm now going to remove my gloves, wash my hands, discard the trash, and document that I have discontinued this patient's IV and that the IV is still in place, or discontinued this patient's IV fluid, but the IV itself is still in place, and that I have flushed it with the 5 milliliters normal saline. I would place the call light next to my patient to make sure that she knows that she can call me if anything, if she has any questions about this, and that I will periodically check on her and make sure that the IV is still in place and that there are no signs of complications.